Great. Well, I have to thank you, Amanda, for the nice introduction, and I have to thank all of you for having me here. It's really, really great to be here. Like Amanda said, it was wonderful to meet her a couple years ago, and very exciting to be here, kind of talking about the registry, and I'll talk about a lot of different things. And please raise your hand if you have any questions in the meantime. But I know we'll try to save some time at the end for questions. So, without further ado, I wanted to give you an idea of where I come from, and that's Sioux Falls, South Dakota. How many people have been to South Dakota before? Raise your hands. Actually, a good number, so that's great. So I'm really pleased to be here. Like I'd said, thank you for having me. I'm here through today, so if you have any questions, I'll be around to answer those. So I have to say, Harrisburg, Pennsylvania is much more exciting than Harrisburg, South Dakota, which is about a 5-minute drive from where I live. So when I told people I was going to Harrisburg, they had a kind of a questioning look on their face, but I had to explain, no, it's in Pennsylvania. They said, oh, that's exciting. So very happy to be here. Today I'm going to be giving you an introduction of the registry, our mission and goals, study operations, and then I'm really going to focus on enrollment and the questionnaire. So I think Amanda might be handing out the forms, so you can kind of review those as I talk about them. And like I said, just raise your hand if you have any questions. And then I'm also going to talk about some future steps with our registry program. So just to start, I wanted to explain about Sanford Health. We are the largest rural not-for-profit healthcare organization in the U.S. and headquartered in Sioux Falls, South Dakota. So just again, so you have a map and you can kind of see where we're located in our footprint. Sanford Health has two sides, the health services, of course, for managing the hospitals and healthcare delivery, but then we also have the research and development side, and that's where I reside in Sanford Research. So CORD started, I'm going to give you an overview of how it actually began. Dr. David Pierce studies, he started the registry in 2010. It's a study that's IRB approved, meaning that it has a protocol and consent forms and has an ethics board that's approved it. He started that registry because he studies a really rare disease called Batten disease, which many of you may probably have not heard of. But Dr. Pierce knew the value of a registry for Batten disease research and thus wanted to start a registry not just for one disease or a group of diseases, but for all rare diseases, knowing that it's very difficult to access information on rare diseases, and having a database of information de-identified can be really, really helpful at understanding trends, the natural history, and also would allow researchers and physicians to do a comparative analysis across different diseases that may have common symptoms. And so Dr. Pierce started the registry. It is located within the Children's Health Research Center at Sanford Research. The registry is a central patient registry for all rare diseases and all ages. So even though it's in the Children's Health Research Center, adults are also able to enroll. And at this time, those who speak and understand English can enroll, and we have future plans for translating into different languages. So just a couple pictures, Sioux Falls, our Falls Park, that's what our city is named after, and our Sanford Research Center up there at the top. So I just threw this picture in here after remembering that Dr. Pierce and Dr. Carey actually met last fall. They were both awarded with the Champions of Hope Award by the Global Genes Project. And I remember that they took a picture together, so I thought that was really neat. And I had a chance to talk to Dr. Carey just before this presentation, and he knows Dr. Jean Hoyme, who's the president of research. They've been colleagues, and I thought just it's such a small world. Having met Amanda a couple years ago, Dr. Hammond actually spoke at our Rare Disease Symposium in last February for Rare Disease Day. So I really feel at home here, and I'm really glad to get a chance to meet all of you as well. So I thought this was a neat picture, and very important that they were awarded for their work in the rare disease research. So I'm not sure if I can, if I'll be able to play this. Actually, I'm going to run and see if I can play the video really quick. That's okay. We'll try again. I'll send the link for it. It's just a little video showing what the registry is and an overview. So without the audio, it looks pretty neat, but you might want to hear the. I don't think so. So I'll send the link. It's on our website as well. So that's just fine. You can you can certainly pause it and we'll move on. We'll try again later. Thank you so much, Dr. Cohen. So the mission of CORDS is to accelerate research into rare diseases, and the goal is to establish an international rare disease patient registry for all rare diseases. And we're doing that by creating a resource of contact and clinical data that allows any individual with a rare disease to enter and for researchers to do a comparative analysis. And then also, as we all know, it's really difficult for researchers to identify where rare disease patients may live. And the registry also provides a mechanism by which researchers and physicians can contact individuals about research study that they'd be interested and eligible to participate in. So we have a very, very small team, but we also have a lot of internal support, which really helps us keep our costs down and really is a very efficient way to do things with this registry. We have Dr. Pierce, who started the registry, myself, and then we have Rayanne Borscheid, who's our clinical research associate, and we are hiring another person as well to join our team, so we're really excited about the growth. Keeps the wheels turning. So we have a CORDS scientific advisory board which reviews the researchers' applications to access the registry. So similar to how Elizabeth mentioned, if anybody off the street wouldn't be able to access the database. They have to have the appropriate approval to do so. They have to have an IRB approved study to access the database, and even then it's just de-identified data. But this advisory board actually will review the application from that researcher and make sure that research study is sound and relevant, so that we're making good use of the registry and protecting the data. Next, we have our institutional review board, which I mentioned is the ethics, the governing body that reviews our study, our protocol, our consent forms. And we have a research IT group, which is on site, and they help with the maintenance of our database. And as we design disease-specific registries, such as the 4P- International Registry, they play a key role in that. We also have an IT department that helps us with our website and materials online, and a marketing department which helps with our brochures and print materials. The Sanford Health Foundation has also provided some funding to our project. So here's our scientific advisory board, a mix of physicians and researchers, all based at Sanford. So we're very happy to have them on board. So CORDS is a patient registry established to help a lot of different key stakeholders in the rare disease community. We've got physicians and researchers so they can access important data and really learn more about the disease. Patients and families can learn about research studies or clinical trials for which they'd be eligible. And then, of course, patient advocacy groups, which I say they're the key stakeholder, they're the glue keeping everything together. They let you all know about the opportunity to participate, as well as the researchers and physicians to access the data. And I have to say that the 4P- support has been fantastic at designing their questionnaire, and they've put a lot of work into the questionnaire and have done a phenomenal job. So we've been really, really happy to work with them. So you may ask, what is a rare disease? And really quickly, it's a disease affecting less than 200,000 people in the United States. So it's based on prevalence. And the Global Genes Project, which I referenced earlier, has some facts that kind of give you an idea about how many people are affected by rare diseases. So there are about 7,000 known rare diseases affecting almost 30 million people in the United States. 80% are genetic in origin, 50% affect children. And one fact that I thought was kind of very, very interesting was approximately 50% of rare diseases don't have a specific foundation or organization that support or research their disease. So really there is a paradox of rarity. So while the diseases may be rare, there are many rare diseases. And one important point to consider is that rare and common diseases may often have similar symptoms or common symptoms. And so by studying rare diseases, we really can learn about other rare diseases and common diseases as well. So it's important to study and research rare diseases. So a patient registry, another definition that I always like to provide is it's an organized program for collection, storage, retrieval, and dissemination of a clearly defined set of data collected on identifiable individuals for a specific and specified purpose. So it's a real technical definition, but important to, nonetheless, to present. So why do we need patient registries? I think that the panel just really did a great job of explaining the value and giving specific examples of how the patient registry is useful. But patient registries do serve a lot of different stakeholders and really do help with the development of effective therapies. patients and families who are seeking information, researchers who are studying the disease, even for epidemiologists to know how many people are affected by the disease is really important, and also for their ability to analyze the information. And then finally, as Dr. Rubenstein mentioned in this article, is drug companies also play a role as they look to develop treatments. So what makes CORDS unique? Well, it's a central registry for all rare diseases, as I've mentioned, and a lot of rare disease registries are usually disease specific and kind of reside on their own. So this allows for diseases to, for comparative analysis to happen. We do have this really great way to collaborate with patient groups that they have a really great and strong interest in setting up a registry, but it takes a lot of time, effort, resources, and infrastructure. As Dr. Carey said, this is a really important infrastructure project that oftentimes it's hard to have the right software and the data security and an IRB. It's hard for a patient group to have all of those things. So we are just thrilled to be able to partner to establish this, this project. Any researcher with IRB approval, it wouldn't be just at any specific institution. As long as they have IRB approval, we would allow them access to the de-identified data. The 4P- support group will also vet those applications just as as they come in, they'll be able to approve or consider if the researcher should or should not access the data. And then finally, there's no cost to enroll, no cost for researchers to access the database, and no cost for the patient group to establish or maintain the registry, which is really important to us. If our goal is to accelerate rare disease research, we have to remove all obstacles, and that cost is one thing that we just really want to we avoid charging anyone, and we do have internal funding that allows this project to be possible, but as you saw, we have a small team, so that helps keep our costs low. So just to give you an idea, you might think, well, how big is the registry? How many people are enrolled? So as of this week, we had over 1,500 participants that are fully enrolled, and we have another 900 people that are in screening, meaning they haven't gone in to fill out their forms. So that's an important thing to point out, is that it's really important if you want to enroll to fill out the questionnaire, and we do have the forms here today. And there are 272 different unique rare diseases, which is quite interesting. I mentioned there are 7,000 rare diseases that are known, and so there's a lot of work to be done. But we do have participants from 50 US states and 21 different countries. And on our website, we have, not only do we just have the video that I was going to show you, but we have a metrics page which shows kind of the growth over time as well as the current metrics. So you can see, I put this as so you can see kind of the growth of the registry over time. And you can see we launched our web-based portal for online enrollment in April of 2012. So that's that little peak right in kind of the middle. And then over to the right, you see another peak, and that was when we established the Patient Registry for the National Ataxia Foundation. And I wanted to point that out because I think that the partnerships with patient advocacy groups is really, really important, and the patient groups do a great job at promoting the registry and the importance. And so that's a really good demonstration of the value of a registry and the patient group's involvement. So how are patients and families involved? So participants that enroll can complete the questionnaire, read the informed consent form, complete the questionnaire, and contribute that information to the CORDS database. Enrollment, like I said, involves reading the consent form and completing the questionnaire. Participants may learn about research opportunities for which they'd be eligible, and when notified, it would be up to you to decide if you want to participate or not. So we notify you on behalf of the researcher or the physician, and then you have total decision on yes or no if you want to participate. And if you do want to participate, you contact the researcher with the contact information we've provided. So how do researchers actually access the registry? So that brief application I mentioned, they just have to prove that they have IRB approval, provide a summary of their research, that our scientific advisory board can review, as well as the 4P- support. And they would log in, we'd give them the username and password to log in, and they would access only de-identified information. So your information is, there's a study ID and there's no identifiable information located in the database. So then they can do some querying and searching, and it's a relational database, so they can really look into a lot of different interesting things, and also identify participants that want to participate in research. As we'll talk about in a little bit, there's a section on your interest in participating in research, so that's how they would know who to contact about a study. And as I mentioned, we contact you on behalf of the researcher. So how is 4P minus support involved? So this is a unique collaboration, as I've mentioned, for groups that don't have the ability to start a registry. We offer a lot of different options, which I think is really important. Through CORDS, the patient group can use the general questionnaire, or they can customize a questionnaire, which is what 4P minus support did. We do have IRB approval, so that there's no need for the patient group to apply for that or pay for that. We have the software infrastructure in place for secure data collection and management. We have IT personnel on site to troubleshoot if there's any issue with the online enrollment portal. And the patient group also can move the registry at any point in time. If down the road something, if there would need to, if it would need to be moved to a certain place, we have that capability so that the registry data is not just stored in one spot. So we have over 40 different partners that have worked with us to set up a registry or use our general questionnaire. So it's been great to work with a lot of these different groups. And you can see there a number, not all the logos are up there because that would make the file size too big, but they range in diseases that affect children and adults. They are sometimes genetic or metabolic. It's just a wide range of diseases. So our current registry software, I always want to touch on the software that we use to manage and collect and disseminate the data. It's called Velos eResearch. It's a centralized relational database, CFR 21 Part 11 compliant with 2-level authentication. It's a granular security mechanism, and I won't go through all of these in much detail, but just to assure you that the information is collected, stored, and managed securely. And we also have a secure patient portal that allows for online enrollment. And then coming soon, so that software that we've used for the beginning of the development of the registry made it cumbersome. It was a 2-step process, and so now we're designing a new software, which is very, very exciting. It's going to make it easier for participants to enroll in one simple step. It provides an improved user interface to make it easier for participants. That's a real priority for us. And it allows you, so if you fill out your questionnaire today and we contact you in a year to update your information, you can actually see the information that you provided today or this weekend so that you can review it and confirm it rather than entering it in over and over again. So that's a really important piece that we just feel is very important because we know it's tiresome to fill out questionnaires time and time again, but it's important to have it updated as well. So we're excited about that. And also we'll have another functionality that will allow you, as you enter your data, to compare your results to others that have also enrolled in the registry. So you'll have a report that comes back as well. So now we're going to get into the enrollment, and this is probably a really important piece. So I'll go through this in detail, but we do have an online enrollment process, which I've mentioned. We do offer mail-based enrollment for people that may not have access to the online enrollment platform, and we do in-person enrollment. So today there's an informed consent form. You should receive a packet with that, as well as the questionnaire, and an assent form as well if your child is able to provide assent. The questionnaire is brief. It probably will take about 15 minutes to complete, actually. It is a 4-page questionnaire, which is much shorter than a lot of the questionnaires that some of our groups do use. So I think you can be thankful for that it's really not long. It shouldn't take you too long to do, and I think that's great. It captures a lot of really important information. So the informed consent explains the purpose, your participation, options for data sharing, and you can always decide if you want to stay enrolled or withdraw. It also has our contact information for questions. So the 4P minus questionnaire specifically asks for these bullet points here of this information, which I'm going to go through step by step. One thing that I do want to mention is that we do utilize the National Institute of Health, their Office of Rare Disease Research. They have a list of common data elements, which they have developed to help standardize data so that all of the registries that are out there are collecting the same data elements so that data can be harmonized a bit better. It's not helpful to have registries asking questions in different ways and having different response options. They really believe in this initiative to standardize and harmonize data. So they came up with this list of the common data elements, and we're happy to be able to implement them. So the 4P minus questionnaire uses those as well as the disease-specific questions, which the NIH did not have on their list, of course. So on the questionnaire, so if you do have the form in front of you, I'll just go through kind of the different sections of the questionnaire. And if you don't, this will just be a good reference as well. So the first thing is first. There's a date of entry. So if you aren't filling out your form today, you'll want to put that date of entry there. There is an envelope that you can use to mail it in, but I'll be here to receive the forms. So you'll also answer who's completing the form. And I think in most cases it would be the parent or guardian of a participant who's under the age of 18. But we just need to know if it's an adult participant, a parent, or a legally authorized representative. So just so you check the correct box there. So next we have data sharing preferences, and they are mentioned in the informed consent form, but I wanted to go through this in detail. So you have options for being contacted about future research studies. So that's the first question. Yes, no, and don't know are the response options, of course. So the research studies might be filling out another questionnaire. They might be participating in a research study by providing a blood sample or a saliva sample. It just could be a wide range of things. So we're not sure exactly what type of research study, but if you think you'd be interested, you can answer that question accordingly. So the next part is I give permission to CORDS to contact me about donating a sample of blood, tissue, or other biospecimen for research in the future. So similar to being contacted about future research studies, this lets researchers know, okay, this individual would be interested in participating, so that we're not contacting everybody in the registry that may not be interested. So the third one is I give permission to CORDS to provide a subset of de-identified information to other patient registries collecting information on rare diseases. So this particular question, as I mentioned with the Office of Rare Disease Research, they have what's called the Global Rare Disease Registry. And that is basically a hub of de-identified data that if we have permission to share the data, and if you'd like your de-identified information shared, we'd be allowed to share that with the NIH's database. And again, it would be all de-identified, of course, but it would just help researchers, as I mentioned, those different disease-specific registries that aren't linked. It would allow those researchers to do a comparative analysis. So it's kind of like the CORDS registry model, but the NIH is supporting that. So the last option is I give permission to CORDS to provide my information that may or may not be identifiable to the following patient advocacy group for non-research purposes. And so the 4P- support group is there. They have signed a participation agreement indicating that the 4P- support won't use the information for research. If they were to use information for research, they have to apply just like any researcher. But this would allow them just to identify trends in the registry data and kind of help develop questions for the researchers. So the contact information is the next section. I won't spend too much time on that section, but it would be for participant information for the child or the individual that's enrolling, for the parent, legally authorized representative, and a secondary contact, just in case we can't contact the parent or the LAR. So just double check to make sure that the email address and phone number are very clear. Sometimes we'll get the forms back and then the email may bounce back because we couldn't tell what the email address was. So just a minor thing, but it's important just to double check. For communication preferences, we provide options for how you'd like to be contacted. We also give you options if you wanted to enroll online in the future. You can check that box and we'll be sure to email you the enrollment information so you can enroll online. Also, we have special communication needs. If there are any, please indicate those at the bottom. So this is a standard sociodemographic section. This is the NIH's common data elements that they have listed. So some of the sections may seem a little bit interesting, or they might not seem relevant, but this is the way that they've standardized the data. But there always are options for other specify, so feel free to answer accordingly, or it's important to answer the questions, but if you don't feel that you fit into any area, just be sure to put other unknown. That's why we put those options there. So then also the country of birth and the city, town, and village of birth are at the bottom. Those data elements are actually important to answer. The NIH has also supported what's called a global unique identifier, so that when de-identified data is shared with other existing registries, we'd know which registries are duplicate entries. So if you had registered into multiple registries, it would be possible to generate a unique identifier using those data elements there. Again, it would be completely de-identified, but it would be a way to know if you were a unique participant or not. So that section is pretty straightforward. The diagnosis sections, I think, were very, very well done. And I probably won't go through these point by point, but if you do have any questions on them, please let me know. I'd be happy to answer. They give options for the different types of diagnoses, and you can indicate the symptoms as well. They're all listed there. And again, if you do want to specify further, you can check the other and type and write that in. So we also have a section there for co-occurring conditions as well. So genetic diagnosis, this section, as I mentioned, it was really well laid out and determined. So I think if you can go through each section and answer those. Again, it has where was the diagnosis made. I think that was mentioned earlier. If you don't know, you can check that box. And also for the genetic diagnosis section there. So those are important sections to fill out as well. And if you have questions, again, just let us know. The family history section is very, very straightforward. You can select all that apply. This is an NIH Office of Rare Disease Research question, a standard data element that they like to ask. And then finally, this section, the clinical research participation, is at the end. And we wanted this is a great thing that Amanda had added, just some instructional text on at the top. Most families have not previously participated in clinical research. However, if the participant has been enrolled in any other studies, please describe these research activities here. And she wanted to include, the most common response. But if you do have any questions about that, I'd be happy to talk with you one-on-one on that. So if you have donated a sample for research previously, we also have a place where you can indicate the type as well as the location of where that specimen was donated. So after completing the questionnaire, what's next? So you'll return your questionnaire, and by returning your questionnaire, you do provide your consent to participate. So you don't need to sign the consent form. It's just a 2-page front and back of 1-page document. And if you return your questionnaire, you're consenting to enroll, and the data will be entered into the secure database at Sanford, and then we'll be contacting you annually just to update your data. And like I said, if you do choose the online enrollment platform to check your data in a year, you can review what you've inputted and then just confirm or edit it if it has changed, which is really, really nice. So let's see, I think that covers that there. And then the final slide, I like to put up this quote just on the value of a rare disease community and a patient group in a registry, and the value of a rare disease registry. But it's just a really important thing that a rare disease community can do, because it provides critical disease knowledge, making the disease easier to study and increasing the probability that a treatment can be developed. And this quote came from David Meeker, who's the president and CEO of Genzyme. But I do think it's really telling of the 4P- support group and how they're dedicated to the registry and really understand the utility and the value of it. So thank you so much for having me. I think we'll be answering questions here. Maybe in a moment. I'll defer to Amanda.